My name is Chris Kemple. I'm a family physician, and I've been in practice in Beloit for 20 years this summer. And I came here out of residency with the thought I wanted to practice in a small town that provided a lot of services and that was a thriving community. And we chose Beloit primarily because it looked like a place that would be prosperous and would be a good setting for that. And particularly chose Beloit not because of the town size, but because when we looked it over, we realized what an unusual hospital and medical setting it was for a town this size. I had thought about towns like this because as a family doctor I wanted to do the whole gamut, but I also realized I wanted backup. I wanted to have some other physicians I could get away. I wanted ability to take care of quite ill patients so I wouldn't have to send them frequently, and we found a hospital here that was providing pretty much a full service of a full gamut of services, and those have only expanded in the 20 years I've been here by quite a bit. Our hospital itself has had two major renovations within the last 10 years. In fact, I've been on the hospital board for about 10 years, and we've seen just a tremendous expansion of those things and our capabilities. A lot of towns in these type of cities, I mean, this is not a small town, even though it doesn't seem like it to us, but many times hospitals and counties help build the clinics and help provide the facilities, but we built a quite large clinic about 15 years ago with our own, just the four of us, or five of us that were here, pretty much built that ourselves, and that gives us the opportunity to benefit from our success and opportunities. At the same time, we have a very close relationship with the hospital. We try to be very complimentary to them. There's never been anything adversarial in our relationship. In fact, again, I'm on the hospital board, and so we really see that we have almost everything as a mutual interest in terms of trying to be proactive in looking in the future, and also trying to do things that will help serve the medical needs of the community, and also make us continue to be effective as we go forward. I think for a general surgeon, the opportunity is that you're going to have an immediate referral base. I mean, all the physicians in the group are going to be doing their best to keep you busy. You know, we have probably there's 4 or 5 other communities around Beloit that we draw from, and we serve a lot of those patients, not just in those different communities. So that's our patient referral base, and we're going to send all those that we can to a general surgeon that affiliates with us. We have a very competent nursing staff that we've had a full spectrum of surgical services for quite some time. We have very competent ICU nurses, and so a lot of times in a rural area, people aren't used to taking care of critically ill patients, so it's kind of hard to gear up to do that, even if you have somebody that brings a new service. In our institution, we've, I think, done a pretty aggressive medicine locally for, again, the 20 years I've been here. Our capabilities keep increasing, but historically, I think we've really tried to be thoughtful about what we do, and yet also do as much as we can locally.